Cancer does not play nice ever. It is aggressive by nature, it is destructive, and it needs to be stopped. And so we need to pull out the strongest, most powerful tools that we have to stop that cancer, essentially, and to, at the same time, ideally, support the health and vitality of the person. So we are going to lay out all of the tools on the table, pull their labels off. I don't care if it's conventional or so-called natural. I want to use the best tools for that person. So how we choose those tools is really a matter of determining at various phases along that journey um, what do we need that's going to what can provide us the most powerful way to stop the cancer in its tracks, and what is most likely to do that with the least amount of harm. This kind of benefit harm seesaw that we're on, and we want the most benefit and least harm. That's not always perfect, right? We know that, for example, chemotherapy, which is super powerful, can also be very harmful. So in that case, then we have to say, well, how can we get that seesaw tip back up so that there's less harm? Are there some complementary therapies that will support or minimize that harm, not cause interference, not add to potential harm in any way, and maybe even in fact support those conventional treatments? So it becomes, yes, an art, but it's really, I think, an informed art, an art that's based on our understanding of science and the published evidence that we have on various things. Another way to think of that is that when we have a disease like cancer, we need medicine, and sometimes we need strong medicine. And chemotherapy, for example, is strong medicine, but that's what we need to help us with this dis-ease in our body. But I just want to make it very clear that, in my opinion, it's a travesty, actually, that most people are only given the option of the strong medicine and are not also given tools that they can employ to improve their health, their vitality, reduce their risk of recurrence, maximize their ability to handle this strong medicine. And I think that, for me, that's really what is so powerful about integrative medicine, is that it involves the patient in their own journey in a much more proactive way, and in a way that can help them overcome the disease, but also, in overcoming the disease, put them very squarely on the path towards greater health.